Good afternoon and good morning to you if you are on the West Coast. My name is Jose Leon, Chief Medical Officer for the National Center for Healthy Public Housing. Thank you so much for attending this live activity, and we are very pleased to have a great speaker for today's webinar. And I want to thank Southern AIDS Coalition for making this activity possible through a partnership with the National Center for Healthy Public Housing. Before we get started, we are the National Center for Healthy Public Housing. We provide training and technical assistance to community health centers across the nation, specifically those serving public housing residents. So thank you so much. We would like to thank HRSA for making this live activity possible. This is a live activity. At this moment, all lines are muted. We are going to have a Q&A session at the end. Please, if you have any questions, save your questions. You can use the chat box and type your question, or you can use the raise hand icon and your line will be unmuted. We have the learning objectives for today's webinar. We are going to learn or review some definitions and common terms. We are going to go over some historical context of transgender and GNC persons, and then review some of the mental health issues associated. And we are going to discuss bias and discrimination, look at the HUD's rules and policies, and we are going to learn some rules and engagement. Just a brief overview, there are over 2 million residents living in public housing. 38% of those living in public housing are children. 59% of those living in public housing are female. 55% have less than high school diploma, and over 83% are below the poverty line. There are 107 health centers funded by HRSA to provide services to public housing residents. According to 2018 data taken from UDS, over 100,000 of the patients were served by the 107 public housing primary care grantees, and there are 356 health centers providing services to patients. These are health centers located in or immediately accessible to public housing, and in 2018 they served over 4 million patients. In regards to these conditions affecting public housing residents, and this is not only public housing, but those receiving HUD-assisted or receiving assistance from HUD, we can see that most of them, when you compare the HUD-assisted people and the adults or the general population, basically those living in public housing or receiving funding from HUD have a higher risk of diabetes, asthma, COPD, being overweight or obese, and have some type of disability. In regards to smoking, there is a HUD's rule banning smoking in public housing. And 2017 data shows that those living in public, about 1/3 of those living in public housing are current smokers. In regards to HIV, and again, this is 2018 data. In 2018, over 4,000 patients, HIV patients went to a public housing primary care facility to receive services. And in 2018, over 89,000 patients were tested for HIV. And this is a really interesting slide. It shows patients by sexual orientations and patients by gender identity in public housing. I'm sorry, this is for all health centers. And basically, it shows that in regards to sexual orientation, 46% of them said that they consider themselves straight. However, the bisexual percentage and the lesbian or gay are very low, and many of them, around 9% of them, chose not to disclose, This is due to stigma and other issues that we are going to discuss today. And in regards to patient identity, 27% of those served in FQHCs were males in 2018. 38% were female. Transgender, they said 0%, and others 29%, and chose not to disclose 6%. So this is again due to the stigma and people are trying not to disclose their sexual orientation or their gender identity. So this is the point of discussion and why we believe this is really important to discuss today. And I am very pleased to introduce Ms. Tori Cooper. She is the Human Rights Campaign's Director of Community Engagement from the Transgender Justice Initiative. Tori brings many years of advocacy working on behalf of the transgender community, persons living with HIV and marginalized people across the country. She brings to the HRSA team a long history of fighting for health and financial equity for those whom traditional systems have failed. Tori earned a Bachelor of Arts degree in Human Services and is matriculating toward her Master of Arts degree at Ashford University. Prior to joining the HRSA team, she created Advocacy for Better Care at Atlanta, serving as a health and equity consultant, providing capacity, assistance, curriculum development, and multidisciplinary trainings for large and small organizations. She served as prevention specialist, health educator, trans coordinator, and a variety of other roles at community-based organizations. She is a subject matter expert with the CDC, public health advisor, and consultant. Over the last 30 years, Tori has built a reputation for excellence as it pertains to increasing visibility, access, and opportunities for Black people, people living with HIV, and transgender communities. Tori is a proud Black transgender woman who aims to inspire through excellence. She is dedicated to improving health outcomes and advancing policies that bring greater equity for all of the communities that she represents. Without further ado, I'm turning this over to Tori. Good afternoon.
Good afternoon, everyone. Thank you so much for having me. I'm really optimistic about this call, this chat, this call, this presentation. There's a lot of good information here, so I hope that you all will invest about 55 more minutes with me today. We're going to get through this and it's going to be great. The name of this presentation is Engaging Trans and Gender Nonconforming Communities. And particularly we're talking about in public housing, in shelters, and all of that other kind of stuff. So my name is Tori Cooper again. Thank you so much for that amazing bio. I feel like I want to know me myself. My pronouns are she, her, and hers, and it's important to understand that pronouns matter. And they're certainly going to matter in the work that we all are doing and in the wonderful work that you all are doing. Next slide, please. So I like to put a disclaimer at the very beginning of my presentation. I am an expert, but I'm not the only expert. And what that means is I give a lot of great information, but it's not the only information that you can get out there. Words and language that are used in this presentation, that are used in any other presentations are fluid, and they're also regional. There are some things that I might use in a presentation in Northeast Washington, DC, that are totally appropriate, that if I used in Southeast Washington, DC, it might get me punched in the jaw. So it's important to understand words and language are regional and they're also fluid. And most importantly, we don't have to agree to be agreeable. And that's really, really important. As humans, as part of this human experience, we will not agree on everything. But in every presentation, I do as much as I can back up my information with science and citations. And it's difficult to go wrong when you use the two of them. Next slide, please. So we have very simple learning objectives, and these are not by any means comprehensive. We're going to discuss some definitions in common terms. We're going to understand a little of the historical context of transgender and GNC, or gender nonconforming persons. We're going to talk a little about mental health. And for all of us that are doing this work, it's important to understand what a huge part mental health plays in not just the decisions, the way that people come to us, I'll say it that way. We're going to talk a little about bias and discrimination, and that's really, really important because bias has a way of rearing its ugly head into almost everything that we do. We're going to talk a little bit about HUD, because HUD pays the bills for a lot of the work that we do. And we're going to leave with some very, very simple rules of engagement. There's also going to be a short Q&A section towards the very end. So I'm going to try as much as I can to push this session along. Next slide. So what is trans, you may ask? So this is one of the images that you commonly see representing, talking about, discussing transness or trans identities. And this is our gender-bread person. Get it? Genderbread, not gingerbread. So as you can see by looking at this, identity is all in your head. It is who you think that you are, how you think of yourself. Your orientation is in your heart, who it is that you're attracted to, your sex. That's now, we're using that as in a scientific way. Your sex is what's between your legs, and your expression encompasses all parts of that together. You will see towards the right of your screen where you see gender identity. Now, these are simple terms that describe 3 different matrices for gender identity. The truth is, for many trans and GNC folks, they fall somewhere along this line. Your gender identity could be as far as a woman, simply a woman. I am simply a woman, that is who I am. And for others, it may be somewhere in the middle where you identify as gender queer. And for others still, it could be at the other far end from woman. The furthest you can get away from woman is simply man. And so for many folks, they fall somewhere in between on that line. When we're talking about gender expression is how you demonstrate your gender based on traditional gender roles. In other words, how you act and how you want people to perceive you, how you present yourself to the world. Again, 3 different points on the spectrum. We have feminine on one end and masculine at the other, and then androgynous in the middle. For many folks who are trans identified or identify as gender nonconforming, they fall somewhere in the middle of that. And even for folks who may not identify as trans or GNC, all women don't present in very feminine ways. Your expression is simply the way that you want the world to see you. Based on the genderbread person, your biological sex, and we know that there are essentially 3 different distinctions, and on legal documents here in the United States, there are actually only 2. A person is born and assigned female or assigned male. But what we also know is scientifically between 2000 and 1 out of every 2 or 3,000 births, the live births in the United States, is a person who is not exclusively male or female. That person would be identified as intersex. What has traditionally been done in the United States is if a child is born and it is not distinguishable whether they are male or female, a doctor will consult with the parents. Quite often surgery is done even before the child is taken home, or certainly before they have any understanding of what's going on. And then they're raised and socialized according to what decision the parents and doctors made for them. Sexual orientation. Sexual orientation, again, just 3 words that describe different matrices on the spectrum. Heterosexual. A heterosexual person is a woman who likes men, or a man who likes women. Where the other end is a woman. Homosexual is a woman who likes women, a man who likes men, and then we have bisexual in the middle. Well, the truth is, for a lot of trans and gender nonconforming folks, and even non-trans, or what we refer to as cisgender or cis people, orientation is much more different than just those three things. You might kind of like girls, but you're not bisexual. What we often see is there are a lot of women who are in lesbian relationships who don't identify as lesbian. Your sexual orientation is just that. It is what you are, who and what you are oriented to. And it plays no part in your gender or your gender identity or gender expression. Next slide, please. So here's some common terms that we're going to talk about, or you will hear me using, or that you may have heard in the work that you're doing or just outside somewhere. My gender identity is who I tell you that I am. My gender expression is who I show you that I am. My sexual orientation is who I am attracted to. Transgender, for the purpose of this discussion, I identify as a woman, man, both, or neither. Either way, that's different than what was assigned at birth. You don't see these terms too often anymore, but transsexual, spell one of those two ways. But for the purpose of this discussion, transsexual means I have adjusted my body to more closely match my gender identity. Drag queen, I dress up for entertainment. RuPaul, Martin Lawrence, Tyler Perry, Tony Lemon, for those of us, and Jack Lemmon and Tony somebody else, who were in a movie with Marilyn Monroe, for those of us who are over 50. Androgyny, not necessarily masculine or feminine, or some variation of both. We will see these terms in real life, even if we don't know what it is that we're looking at sometimes. Next slide, please. Transgender. Transgender and trans describe someone whose gender identity is different than what was assigned to them at birth. A trans woman and trans man are the two most popular gender identities for the purpose of this discussion. Often, trans women or trans men will identify solely as male, female, could identify as both, or neither. Sounds confusing, but it's less confusing once we get through this presentation. Next slide, please. Gender nonconforming describes someone who does not fit traditional labels or presentation and may not identify exclusively as male or female. Some of the pronouns that you may include, but aren't limited to, include they, their, ze, we, us, zed, and there are any number. There's some folks who identify as gender nonconforming or non-binary who don't use any pronouns. And they, T-H-E-Y, was actually word of the year last year by Merriam-Webster. Very, very interesting. Next slide, please. So pronouns, my pronouns are feminine pronouns, she, her, and hers. I gave you that on the very first slide. One of the things that's important for us is do not assume a person's gender identity. We think because we see them a certain way, that's who they are. And the truth is, we're not always right. If you don't know, when it's appropriate, ask. If you're fighting over someone for toilet paper at the grocery store, it's probably not appropriate to ask them their pronouns. However, if you're doing a government intake form and you need to know how this person defines themselves, that's an appropriate time to ask their pronouns. If you make a mistake, apologize and move on, but be sincere with it. Next slide, please. So trans is not new, it just might be new to you. The term transgender, even though it was spelled with an ED at the end, was first used in 1970, describing Raquel Welch's character in the movie Myra Breckinridge. I bring this up because the irony is that at the time, Raquel Welch was considered the most beautiful woman in the world. And yet, she played in a mainstream movie a transgender person, a person whose gender, whose sex had changed. I think that's incredibly important to note because we've been around for much longer than many folks realize. Lily Elby was the first person to have gender reassignment surgery in a more traditional sense in 1930. Again, that's important to understand because many of the folks who are on this call were probably not around in 1930. Next slide, please. Often and historically in public health settings, transgender women particularly have been grouped in with men who have sex with men. I have a public health background, and there have been many times on documentation where we have labeled people according to risk. And because trans women have sex with men, there may be two penises involved in it. Often they were simply lumped together with men who have sex with men. So there is some type of intersection. And for some trans folks, trans women in particular, they may have even identified as men who had sex with men prior to some type of physical transition. It's important to understand, though, that these are two distinct communities, and though there is some overlap when we're talking about risk, particularly for HIV and other STDs, that they are two distinct communities. Trans and MSM communities have similar rates of infection and lifetime risk for HIV, which is more than 1 out of 2, and other STDs as well. The truth is, you may already have trans clients and not even know it. In the work that we do, it's important that we understand that we have to provide a place that feels safe for all of our clients, to provide as much information about their own care that they can. Next slide, please. Is your staff culturally diverse? And what exactly does cultural diversity mean for your staff? Cultural diversity could look very, very different in Dallas, Idaho than it does in Dallas, Texas. Does your paperwork and policy include trans and GNC folks? Bathrooms. Do you have single stall bathrooms which have male or female on them? That's a policy that you could change that could actually help folks. Bathrooms are a big issue for some people. They're a small issue for others. Just allow people to pee and poop in peace. Next slide, please. Trans individuals tend to have higher rates of mental health issues. This is something that has been documented time and time again. There's an absolutely incredible project that it was conducted. It was one of the first, it was the first national survey that was conducted by and for trans folks through the National Center of Transgender Equality in 2015. I encourage you to look up that information. It's really, really important. The trans individuals tend to have higher rates of mental health issues. Nearly half of trans people suffer from depression and/or anxiety disorder, compared to 6.1% and 18% respectively of the general population. That's important to understand because this type depression and anxiety disorder, sometimes it can be due to a chemical imbalance or a congenital issue, but quite often it comes from people being mistreated in society by regular everyday folk or from their own families. Next slide, please. Mental health issues primarily arise in response to discrimination, stigma, lack of acceptance, physical and mental abuse that they face on an unfortunately regular basis. Every person deserves to get the best care. And you, every single one of you who's attending this webinar today, could make all the difference in a trans person's life. That's very, very important, because not only could you make the difference in a positive way, but you could actually be the cause of even more chaos. Next slide, please. For many trans and gender nonconforming adults, dealing with discrimination results in a state of heightened awareness. This heightened vigilance leads to changes in behavior, which in itself can trigger stress responses. Even the anticipation of discrimination is sufficient to cause people to become distressed. This is especially important because as humans, we sense danger. For trans and gender nonconforming folks, when we sense danger, just like anyone else, it causes a physical and mental response. Next slide, please. So these are many of the words that we see. The very first words that come up for a lot of us is inequality, biased, prejudiced, unbalanced, unequal, perception, unfair. There's so many words here that all have to do with something called bias. Next slide, please. There are many types of bias, but this presentation deals with essentially 4 different types. They are bias, believing, or 3 different types, excuse me. Bias is believing that some ideas or people are better than others. Explicit bias is when you deliberately hold beliefs about a person or group. Implicit bias are beliefs about others or ideas that are outside of our conscious awareness. Sometimes it is having beliefs about certain groups of people and you don't even realize that you think that way. Confirmation bias is seeking information to confirm our biases and our beliefs. And sometimes that's even scarier because you're setting people up for failure through confirmation bias. Next slide, please. W.E.B. Du Bois acknowledged 100 years ago that the health of minority populations is heavily influenced by the social institutions. Not only do housing and credit form the lifeline of our national existence, but they serve as the economic lifeline for many of us individually. Housing and credit can influence our daily lives. The better one's access to safe, affordable housing, the better one's outcomes tend to be around a range of indicators of individual, family, and community well-being. Over 100 years ago, W.E.B. Du Bois made this distinction, and it still holds true today. Next slide, please. In 2019, this is really relevant information, and I think as we continue to move further along in this presentation, you all will see this. I've just lost, here we go. Okay. In 2019, Gianna Desir in New York City won a $25,000 lawsuit for being denied an apartment. During the early parts of her transitioning, her then landlord began to give her weird looks, as she described in the lawsuit. He actually said to her, "Why didn't you tell me that you were transgender? Thank God I had you come here at night. What would people have thought if they had seen you?" He also worried he'd be thought of as allowing a sexual encounter with Desir if he were to rent to her, and even suggested she stop transitioning until she landed an apartment, telling her that she would look really crazy. So many of us would like to think that we don't live in a world where this still exists. But the truth is, we do. If this can happen in New York City, certainly one of the most diverse places in the world, then it can happen anywhere. And if it can happen in 2019, then it can happen in 2020. Next slide, please. Desir estimates that she met with 5 landlords. Walter, the gentleman, I don't even know if I want to use the word gentleman, but the landlord who is described in this particular article being the 5th. All of whom would say that they had spaces available and then tell her those spaces had just been rented when she met them in person. And after the landlords found out that she was transgender. Clear signs of discrimination. Next slide, please. The Fair Housing Act prohibits housing discrimination on the basis of race, color, national origin, religion, sex, familial status, and disability. A person who identifies as LGBTQ who has experienced or is about to experience discrimination under any of these bases may file a complaint with HUD. HUD's equal access rule requires equal access to HUD programs without regard to a person's actual, and here's the part that gets you, or perceived sexual orientation, gender identity, or marital status. Housing providers that receive HUD funding or have HUD insured loans are subject to these rules. That's super, super important. And I think out of this second bullet, one of the most important things is perceived, the word perceived, because that goes directly back to bias, how we view somebody or who we think that they are or how they are. And often we're wrong. Next, we're actually just about finished with this slide presentation. Number 1 is do your job. Your job is not to sit there and to determine what's between my legs based on what you assume is there. Do your job. If your job is to connect me to housing, then do that. If your job is to take my vitals, then do that. If your job is to complete paperwork for a voting application, then do that. Number 2 is practice cultural humility. Cultural humility says, I understand that I don't know everything. And moving forward in the best interest of your clients then. Rules of engagement. Do unto others as you would have them to do unto you. Rules of engagement. Do not impose your views on anyone. And that's really, really important in the work that we do because there is a power and control dynamic that is in place, particularly when we're talking about housing that doesn't appear in a whole bunch of other relationships. So it's important to understand our views don't matter. Our opinions don't matter. Trans and GNC people's lives are at risk when we are denied housing. I'm going to read that again before we advance to the next slide. Trans and gender non-conforming people's lives are at risk when we are denied housing. Next slide, please. So we moved through this pretty quickly. I thank you all for listening. What questions do you have for me? Or for any of us?
Thanks, Tori. Thanks for your presentation. This is very helpful. I know the health centers may have some questions and all participants. So let's try to get some questions in the meantime. We can go over the Q&A. If you would like to ask Tori a question, you again please use your chat box, type your question, or if you would like to ask a question verbally, please use the raise hand icon and your line will be unmuted. And we would like to give some information regarding our conference as well. Our conference is being postponed due to the coronavirus pandemic. So we do not have a date yet. Please stay tuned. You can visit either our website, www.nchph.org, or you can contact us. You can email us at, you can send me an email to my email address, jose.leon@namgt.com, or you can also call us 703-812-8822 for additional information. So I'm going to stop for a moment and ask Fidel, do we have any questions in the queue?
1 second. Sierra Brown said, "Thank you, Tori. Your presentation was very well informative."
All right,
Thank you, Sierra.
All right, you can also, I'm sorry, Fidel.
No, other than that, we don't have any questions right now.
So in addition, you can also visit our website, nchph.org, and you can find HRSA updates, Medicare and Medicaid updates, information on HRSA's funding opportunities, additional information on senior programs and other resources and services that we provide. You can also visit our website and you will find current and archived webinars, publications, interactive maps, training manuals, information on our in-person activities, on how to submit a training and technical assistance request. You can also contact our staff, any of our staff members, and we'll be more than happy to help you. And just let me stop here one more time. Do we have any other questions?
There is one, but I'm just trying to get a little bit more information about that question. Just one second, okay?
All right, thank you. Tori, in the meantime, I found your slide with the gender bread character really interesting, and there were several terms that you used, and the question is, can you sometimes have a sexual orientation but your sexual identity is different? I'm curious to know whether, your brain or your heart, for instance, are not in sync of what you on these terms, or with these terms.
So, Dr. Jose, that's a good question, and I'll pose an answer like this. If you take the trans identity out of it, we know that there are cisgender people, who is everyone who's not trans. We know that cisgender people are heterosexual, are bisexual, are homosexual, and everything in between. If you then add transgender identities in, transgender folks are heterosexual, bisexual, homosexual, and everything in between. Gender and sexual orientation are not the same. They are two distinct characteristics of human nature. Did that answer your question?
Of course. Yeah. Thank you so much for the clarification. This is very helpful.
And there are a lot of trans-identified folks who are kind of shun the LGBTQ label or moniker, because LGB and Q all describe sexual orientations, where transgender describes identity. And so there are a lot of trans folks who simply don't identify using that same moniker.
Got it. Tori, we have a raised hand So let's see, we will unmute the line so that this attendee can ask the question directly to you.
All right, so we have one question from Regina Cooper. 1 second. Let me go ahead.
That's my mother.
Are you kidding me? No, my name is Regina Cooper. I wish I was your mother. How are you?
Oh, I thought this was a joke.
No, what a coincidence. Your
Right
mother's
before the
name is Regina?
presentation.
Just a coincidence.
It is.
I have a question. So when we schedule our patient day in our office and our clinics, and this is not a negative question, I just want to say that, is it better, or would the group of folks that you just talked to us about, would the group of folks that you just talked about feel more comfortable having a separate day from our other patients, say our Medicare patients, say our well women, that's just women coming in for their annual? Should we separate so that this group of folks that we're talking about have their private day where they're in the office feeling more comfortable from the other patients?
So thank you, Ms. Cooper. That's actually a good question, and there's no easy answer to it. But one of the things I would suggest, I truly believe in the power of community assessments. I ask folks, which day would you like to come in? Because there are a lot of us who are trans-identified people who if I were going to an appointment, I don't necessarily need to be there with just trans folks,
Right.
because my issues as a woman are not just trans issues. I need gynecological care as well, but I also happen to be a woman with a prostate.
Right.
And so I think it's important there was a time when that was simply the way that folks did it, and it made everything work. There are a lot of trans folks who don't identify as trans, particularly folks who perhaps have had some type of medical intervention or surgical intervention. So what I suggest is talk to your clients, ask them where they feel more comfortable, and then accommodate as much as you can. I appreciate the fact that you never use the word comfort when describing folks who weren't trans.
Mm-hmm.
Thank you.
You're welcome.
Thank you so much for the question, and thank you for the answer as well. Any additional questions today?
Not at the moment, Dr. Leon.
All right, so if you have any additional questions, please send it to us. We are going to make sure that Tori gets the questions, and we are going to email the response back to you. Again, thank you for attending this live activity, virtual activity. We know that we are having difficult times with the COVID-19 issue and public health emergency. So thank you so much for all the service and everything you're doing to keep our patients healthy. And I want to thank the clinical and non-clinical staff working at the health center clinics for all the great job that they are doing. Thank you so much, and have a great afternoon. Thank you, Tori, for your presentation.
Thank you.